Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Claudine Holt. Hi, Dr. Holt.
Hey, how are you?
Doing well. I'm so excited you're here to talk about the book and your chapter and your practice. Can you tell us a little bit about yourself?
Yeah, so my name is Claudine Holt. I am board certified in occupational and lifestyle medicine, and I am in practice here in New York City. And I'm also a life coach as well. So I've had a life coaching practice for a couple years now. So yeah, that's a little bit about me.
Fantastic. We're going to delve into the lifestyle medicine side of you. When did you first get introduced to the field of lifestyle medicine?
Yeah, so I first heard about lifestyle medicine about, I'm going to say 4 to 5 years ago through some colleagues at work who were at the time pursuing lifestyle medicine certification. And also, we had someone do a presentation for our department on lifestyle medicine. So that was really where those seeds were initially planted. And yeah, I thought that was interesting. At the time, I wasn't looking to do another board certification. I wasn't really thinking about that. I was more focused on, my coaching, and I was taking coaching certifications and things of that nature. But yeah, that's where I first heard about it. And then really in the past 2 years, as a lifestyle medicine pilot program was being developed at my institution, I started hearing more about it and then decided that I wanted to pursue the training. So signed up for the board review course and really started using those principles in my life as well. And yeah, so it was just kind of that snowball effect.
Wonderful. So let's dive into some of those a little bit more. How do you use lifestyle medicine in your clinical practice? And then you mentioned your life, so I'm going to use that however much you want to share. Don't feel like you need to share too much, but
Yeah.
how do you use it in your personal life?
Yeah, so personally, and I share about this in my chapter in the book, where I had an injury before the year before I went to medical school, actually, the year I was applying to medical school. And I think before then I had some, bad habits, but I always overcompensated with like exercise. And so I didn't have always good habits when it came to like eating, but I was able to sort of out exercise those bad habits, and I was always active and up and doing things. And so when I had this injury, I broke my ankle. It was a really bad complicated fracture and a third-degree sprain. I was down. Essentially, I had an operation. I was down for several weeks, and it took a lot of time for me to get back on my feet again. And so all of those bad habits just kind of came up to the surface. And really, during that time, I realized as well that there was some emotional stuff going on too, being not able to go out, not able to do things, having to rely on other people to take care of me. And so I think those bad habits from my college years really just all, came together at once, and my weight just started to go up. And when I started medical school, it just seemed to keep going up. And I remember seeing my my doctor back home, but also I went to the student health clinic on the medical school campus. And the advice that I got was just, well, you just need to stop eating, like just stop eating. Like, I don't feel like I'm eating, that much. But anyway, okay. So I attempted to do all of that and still working out and exercising, but I just wasn't really able to really get that back on track. And basically, like 2 years into medical school, it was just after I came back from doing an internship overseas in Geneva. I missed a cycle, and that had never happened before, so I knew something was really seriously wrong. So anyway, fortunately, I went to someone at Student Health, a GYN, and she was very astute, and she said, "This could be something hormonal going on." So she said, she gave me some medicine and said, "See if this works, but then if something happens again, come back and we'll run some blood work." And I had a second missed cycle a couple months later, and I was basically diagnosed with a hormonal issue. So that really was explaining what was going on in my body. But just knowing about that, the answer that I received, the treatment was more medication. And I had side effects from that. And I realized that this isn't really the way either. So, kind of through coaching, learning about self-coaching, learning about how our mind works and why we cope or buffer with, food or other things, right? Salt, shopping, spending, all those things. It really helped me to start having more awareness about how my own mind was working. And then also around this time, I was learning more about lifestyle medicine and sort of just putting all of those pieces together. And essentially, I became my own client, my own patient, and started to do some of the things that I also recommend to my patients. So really those 6 lifestyle medicine pillars, focusing on that, and really that emotional piece, that mental health and well-being piece, which I already was getting from life coaching, that has been very foundational for me in combining that with the nutrition and the exercise and the sleep and all of those things. So I was able to just sort of put all of that together. And last year I lost over 40 pounds, and I'm still, thank you. Yes, I'm still on my
Congratulations. I know they couldn't see me, so I was clapping for you. All right, keep.
Yay. Thank you so much. And, I'm still on that journey as well. So, yeah, but it feels good to be an example for my patients and to show them what's possible as well.
So how do you use it in clinical practice on a daily basis?
So, in the practice that I'm in, I'm very fortunate. I'm part of one of the World Trade Center program clinical centers of excellence. So, we take care of first responders, people who are at ground zero, either volunteering or part of the rescue and recovery effort. And so we take care of them and their health issues. And what I try to do is incorporate lifestyle medicine into that daily practice. So even though we're not their primary care physicians, we still, of course, deal with their issues. So they bring their blood pressure into, the office, or their diabetes that's uncontrolled, or their cardiac symptoms, or their whatever respiratory symptoms. And so really trying to encourage them to follow those pillars of lifestyle medicine. So I incorporate that into that part of my practice. It does take time, we don't have that time carved out, but you try to blend it in as best that you can. But our practice, we've actually been exploring lifestyle medicine as an actual pilot program where we are looking at reflux, which is something that many of our patients are certified for through the World Trade Center program. Just from the dust exposure, they are more prone to getting reflux because of that ingestion of the dust. And so many of them have that. Many of them are on PPIs and have been on PPIs for several years. And so, really, in an effort to get them off of that, and also to manage some of those other contributing factors like obesity, overweight, uh, NSAID use, smoking, drinking, we've decided to create this pilot program to help them with GERD, but also any other goal that they would want to address. So they get to choose 3 endpoints out of the 6 pillars. They get to pick 3 goals in those 6 pillars, and we sort of help them move towards achieving that.
That's amazing. Congratulations. That's really important work that you're doing. Um,
Yeah. And we've been seeing already a significant downward trend in those reflux scores, and also in weight loss, if that's their goal, or getting more sleep, if that has been their goal. So yeah, it's been a great project to be a part of.
I'm sure it's very gratifying. Wow. Well, let's switch gears a little bit to the book, How Healers Heal. I'm so excited that you're part of our book. Can you share with us, why do you think other people should read this book? And obviously, I want them to read your chapter and learn more about you, but why should doctors and non-doctors, patients read this book?
Yeah, that's such a good question. I think, well, first of all, as physicians, we have a responsibility to really lead the way for our patients. And there's that proverb that says, physician, heal thyself, right? So we want to lead by example. And I think this is a big gap, a big deficit in our medical education, learning about nutrition and, exercise prescriptions and, mental and emotional health, right? Unless you went into like psychiatry as a specialty. We just get one rotation in that in medical school, right? And so I think we just need to do a better job at modeling this and understanding this, and seeing other physicians share their stories and how they've incorporated it into their lives and their practices, can help other physicians who have never heard of lifestyle medicine or like, what's that, right? Can give them an exposure to it, but also a very practical understanding of how this might look and even in their own lives. Because we know that physicians are not always getting in their exercise or, getting in all of their nutritional, touch points that they're supposed to be doing, right? So I think that's definitely one reason. For patients and non-medical folks, I think it's just very inspiring to see physicians who are not just talking the talk, but walking it as well, who are actually on the ground, like doing the work. I'll be very honest with my patients. Like, I know this is hard. I've been there. I'm still there, right? So I get it when we talk about weight loss or when we talk about, exercise. And so I will share with them, well, this is what I do, or this is how I, incorporate my busy schedule, how I'm able to like cook or meal prep, or these are some of my ideas. Let me share that with you so that they can get a sense of what we're doing. So I think it kind of brings down this idea of patients seeing physicians as like up here and like they're down here. I think it kind of evens that a little bit so they can see that we're just like them, we're trying to live out our lives as best as we can and to be as healthy as we can so that we can go out there and help as many people as possible. So I think it's inspiring for patients to witness that as well.
I love your answers. Thank you for that.
Thank you.
What is your number one tip for self-care or lifestyle medicine changes while people are waiting for their copy of this book in the mail?
My number one tip is going to be to remember that you can't give to other people what you haven't given to yourself first. And I feel like this is so foundational and sometimes we miss this. And especially as physicians, as people who are in a healing profession where we're just trying to give and give and give. And that desire to give is very noble. And I get it. And I struggle with that too. But also taking a step back and realizing that I can't give effectively. I can't practice as effectively as I can if I'm not taking good care of myself. So if I'm not getting enough sleep, if I'm not eating vegetables and fruit, if I'm not, exercising and moving my body, if I'm not, praying or, meditating or going to church or doing those things that I know are very important for me to just keep me at a certain emotional baseline that I want to be at. If I'm not doing those things, then I can't be as good as I want to be or as good as I can be. And so I think everyone in this culture can really do well with taking a step back and really assessing how much gas do I have in my own tank? How much do I really have to give? Is it the best that I have to offer? And if the answer is no, it's not your best or you don't have enough gas in the tank, then taking a step back is totally okay. I think somewhere along the line we have vilified rest or we see it as, being lazy or unmotivated or, whatever it is, but we really need those moments of rest and time to ourselves to be as effective as we want to be. So that's probably my number one piece of advice.
I've been shaking my head. Yes, yes, in agreement the entire time you've been speaking. I totally agree with you. And you put it so eloquently. Thank you for that. That's amazing. Thank you so much for your time today. A couple more things. Do you have anything else you want to share? And then please tell us about how people can connect with you and reach out to you and learn from you.
Yeah, I would just say this has been an amazing project for me personally to be a part of. It's hard to be vulnerable and to open up, but I hope that people watching this interview and the other interviews will go out and get this book and really read it and support it and share it with other people because it is very inspiring. And as far as me and what I'm doing, I do have a coaching practice, and people can learn more about that by visiting my website, www.theembodiedmd.com. And this is really, in my practice, I really try to incorporate mind, body, and spirit, realizing that all of those pieces, we need to address all of them. And we're not just a body, we're not just a brain, we're not just a spirit, but all three. That to me has been the most transformative in my own life is really to integrate all of these things. So that's the work that I help women do, who are burned out or who gaslight themselves, to really try to heal from the inside out.
That is amazing. I'm going to have all the links to your programs listed below the video, of course, and it's in the book. Thank you so much for your time, Dr. Holt.
Thank you. Take care.